For millions living with neuropathy or osteoarthritis, every step can be a struggle, and traditional treatments just aren't cutting it. Dr. Abhishek Reddy and Dr. Joe Furman from NexGenEsis Healthcare take a different approach, one that focuses on the body's natural ability to heal itself. We met with one of their patients, Jeffrey, who finally found relief after years of frustration.
I came to NexGen a year ago because I seen advertisements. Had a nephew pass away earlier with neuropathy, taking gabapentin. I had burning in my toes, my feet were numb, I was unstable walking. I went through their process, their treatments, and within 3 months, the burning was gone. Within 6 months, the numbness was gone. I didn't want a Band-Aid. I want it fixed. I have feeling back in my feet. I am stable walking. I went to the right place to get my neuropathy fixed.
Dr. Furman, a lot of the things that people think are answers to our problems, surgery, pain medications, actually can add more problems and more trauma to the body. That's not what y'all do.
Correct, yeah, and like you just said, the pain medications, they can cause a lot of side effects, unwanted side effects that people have to deal with, maybe take other medications for. And then the surgeries, right? Having surgery on certain areas, that can even cause more damage, whether it's to the joint or maybe to a nerve, causing more damage to those areas.
Yeah, when it comes to neuropathy, what is it, and what are some of the symptoms that people should be aware of that might make them think, I might have neuropathy?
Right, so things like numbness, tingling, burning, typically in the feet or the hands, if they're diabetic or if they've been through chemotherapy, have some sort of decreased blood circulation, some sort of condition of the heart, if they're experiencing these symptoms, then they may be dealing with that neuropathy.
Yeah, all right, when you say numbness, tingling, people go, okay, but it can really impact quality of life and get really, really bad, as you witnessed with one of your family members.
Absolutely, yeah. It can get to a point to where people will experience amputations if they are diabetic, and a sore gets infected. Amputations can occur, which obviously will affect their quality of life, whether it ends up being using a walker or a wheelchair, and they can't stand to cook a meal. They can't climb stairs anymore. They have trouble getting out of the bed. Lots of little things that people don't really realize can be affected will be affected.
Yeah, how is NexGenEsis different in terms of how you treat?
Right, so typical treatments are medications, gabapentin, Lyrica, those are the most common for neuropathy. How we're different is that we use the body's own natural healing properties to rejuvenate and regenerate these nerves, so that we're not just masking symptoms with a Band-Aid, we're actually, like I said, rejuvenating the body's nervous system.
Yeah, all right. One of the other things that a lot of us are going to have to face, because we're living longer today especially, is osteoarthritis, which can be excruciating pain, which people will end up just sitting still, right? So it leads them to a sedentary life. They really cut down their quality of life as well. So when patients come to you, how do they describe what they're feeling?
So usually they're describing pain with more activity. So they may not feel it as much in the morning, but they can. But as they start to use those joints more, the most common cause, like you mentioned, for osteoarthritis, for pain, joint pain, is osteoarthritis, and that's really that bone-on-bone breakdown of that joint space.
And when you hear the words bone on bone, wow, right?
Yeah. So it's definitely not the most pleasant thing. It can really affect your mobility. Again, like I said, it can cause pain if you have it in the knees and you're up walking around using that joint more. You're going to have more of that friction. It's going to cause more pain.
Yeah, and where I started earlier with neuropathy, same thing with osteoarthritis. People are often told, well, you're going to have surgery, or you might need a knee replacement. There are some people who are not good candidates for a knee replacement and things like that, and that's where you all can be invaluable to them.
Yeah, so a lot of times patients are offered surgery as their final or last option, but they may not be able to undergo surgery due to medical conditions, or they may be unwilling to due to recovery time, various other things. We offer more minimally invasive alternatives that really help to restore that quality of life, reduce pain, and have little to no downtime.
Yeah, we're so good at trying to mitigate our circumstances that we kind of like compensate for certain things. This is also one of those things, osteoarthritis, where it's not going to get any better. You need to address it.
Yeah, so typically, as we get further on and as that wear and tear kind of increases a little bit more, your symptoms will usually get worse. They're not going to improve on their own, and so we can help to offer a solution to help restore that quality of life.
We've heard from a number of your patients, whether they're dealing with neuropathy or osteoarthritis. I'm sure sometimes you have a combo deal. People are dealing with both, right?
Absolutely.
And they say it's almost like magic for them, and just they appreciate even the smallest things of life. And one of the last women I spoke to, she said, I can get in and out of my car comfortably, which means she can go places and do things again. So it is restoring quality of life. Gentlemen, thank you very much.
Thank you.
Thank you.
The first 50 callers to mention Great Day Houston will get a complimentary phone consultation to see if you're a good candidate to come in for an exam. The number to call right there on your screen, 832-570-4529. Again, that's 832-570-4529. To learn more, visit NexGenEsis Healthcare.com.